This is a great article on how everything impacts everything, where the article specifically focuses on disproportionate COVID-19 vaccine access in California, impacting some ethnic groups, which then ultimately impacts everybody. So, Dr. Monica Roy, the Assistant Health Officer of the County of Santa Clara Public Health Department, says that our Latinx population and African American ancestry populations have even lower rates, and this is low rates of vaccine uptake. But this is due to systemic issues. Largely, this is the first year that the vaccine has been commercialized, and we know that for some individuals it may be harder to access the vaccine. A lot of this is due to cost barriers, financial barriers, where without insurance, the vaccine is running people anywhere from $150 to $200 per individual. And that even though the CDC does have the Bridge Access program to serve people that don't have health insurance or are underinsured, not everyone is getting the access needed through these programs because it's really hard to get these vaccines in pharmacies. They need stock, they need availability from the Biden administration, they need to be able to administer them, and they're not getting the supply. Where Santa Clara County has been taking sort of drastic measures to make sure pharmacies and individuals are able to take advantage of this program, where they're doing some secret shopper action here at the health department, where they're actually calling pharmacies that have received vaccine through the Bridge Access program and making sure that it's easy for clients to call and get the vaccine and that they're not facing these additional hurdles. And that Santa Clara County is working with the pharmacies and working with the state to try to address these significant issues. Because then we have compounded situations for people that are both not insured and for those that are not documented. Because if you're undocumented in this country, you don't qualify for public insurance, which is an additional group that would not be covered under these supportive programs that we have. But these are people that still need vaccinations, that still need protection. And that's what the promise was with these types of programs and what was supposed to happen, but it's not happening. Where doctors essentially have given up and are saying, well, we hope it happens next season, and then they figure these things out. But that's sort of the crux of the whole issue here, and what this article underpins is that when you don't treat all of the populations, the underserved populations, you're neglecting the entire population as a whole, because we need everyone to be as vaccinated as possible to mitigate the worst effects of the disease, that being COVID. And when we have all of these gaping holes everywhere from people not being able to get access due to financial barriers, people not getting access because the program's not sufficiently regulated and wasn't actually developed appropriately and isn't getting things to where they need to be. And then we have other things like people that being undocumented, not being able to get access because they don't qualify for insurance. And suddenly we have pockmarks all over our entire country in terms of holes where people should have been vaccinated but aren't. And that's a big problem.